Everyone who works in this building and walks these halls has a story to share, a story that connects them all, because somewhere in each of their stories lies the pain of addiction.
If the people in recovery would just stand up and help us, we can save a lot of lives just by using your stories.
Jennifer Turk started struggling with addiction when she was just 13 years old. Erin Wright's addiction almost ended her life. She overdosed with her 1-year-old daughter in the backseat of her car back in 2016. Her husband, also named Erin Wright, spent 23 years addicted to heroin, homeless on the streets of Philadelphia, living his life waiting to die. Now, all of them are in recovery, using their stories to show others there's hope.
By us coming out, recovering out loud, it just may be the difference between life and death for someone who may have suffered in silence.
Voices of Hope is a recovery community organization with 24/7 recovery centers and houses in Harford and Cecil counties. 95% of the staff are in recovery themselves. The rest are family members like Chris Reeves. His daughter Caitlin died after her struggle with addiction, right before her 21st birthday.
The reason I work here is if I can try to help somebody else from not going through what I went through. That's my goal.
But data shows lots of families across our state are grappling with the same grief as Chris Reeves. According to Maryland's overdose data dashboard, 2,590 people died from drug overdoses in 2022. Fentanyl caused almost 80% of those deaths. The San Francisco Chronicle's nationwide drug overdose death tracker shows Baltimore has the highest number of drug overdose deaths in the country.
When I look at the data, I could have been one of those people, you know? I could have been one of those people that is a fatality.
So staff at Voices of Hope work to cut the number of fatalities. They focus on harm reduction methods, giving those struggling with addiction access to clean syringes, Narcan, fentanyl testing strips, and other tools to keep them alive and as healthy as possible. And when they're ready, staff point them to treatment centers and support them in their recovery every step of the way. Erin Wright says the number of people who want help is growing.
So 50 to 60 individuals per month are leaving for treatment. So that truly is a blessing, whereas before it was a great struggle to even coordinate for 5 people a month.
Wright and the rest of his team hope those numbers lead to less overdose deaths and more people joining their staff, using their stories to help save lives. I'm Brianna Ross, WBAL TV 11 News.